The phrase that was very powerful was nothing about us without us, and now it is much shorter. It's nothing without us. So the way to do this is to have people with disabilities doing the work. So that means employing people and doing the work and including them in the work. So as I mentioned before, organizations work within a context of a identity, and they work in the context of information. The work is performed based on information. The relationships are the channels through which the information flows. And typically, there's not enough information in organizations, and it's poor quality information. And in absence of good information, people will create misinformation. But having people with the lived experience of disability working in the organization, whether it's a department, a work group, a team, a company, part of the network of relationships, that provides the organization with lots of really high quality information about accessibility and accommodations and disability inclusion. So my answer is to hire people with disabilities into our teams, work groups, departments, and organizations, distributed throughout the organization, large or small, in a variety of roles. And there's some really good research. Dr. Jeffrey Moore at Anderson University, small university in South Carolina. Since 2007, he and his doctoral students have been studying work groups that employ significant percentages of people with disabilities. And they found that if about 20% of people have a disclosed disability in a work group, some really cool things start happening. And there are some kind of tangible bottom line things like lower turnover, absenteeism, better safety, better employee satisfaction, better customer perception. But then the identity changes, the culture starts to change. And something he wrote, one finding, managers in inclusive organizations undergo a significant transformation from autocratic, production-focused leaders to inclusive, relationship-based leaders, and back to relationships being the channels through which information flows. My contention is to really bring this stuff to life. You have to have people with disabilities not only being considered, but being involved in doing the work.
Kirk, in your bio, it suggests that you are, and I'm sure you are, a master connector of key decision makers across sectors. So clearly requires some sector collaboration there. In the consulting world, I'd love to hear about how your work in cross-sector collaboration has helped related to the translation of very impactful, inclusive employment practices.
That's knowledge translation means how do we take what we know to liberate people, to make them more free, to pursue thriving in whatever way that means to them. When we were talking about it, I can remember being, my retina's detached when I was 5, so I was sighted one day and blind the next day. And when I went into first grade classroom at Oregon State School for the Blind and they had that big tactile globe, that set me free right there. How can we use AI to improve the lives of people in transformational ways, not incremental ways? And that's gonna mean different things for different people. As also Estee Lauder has an app to help blind people put on makeup better. That doesn't free me because I'm not a makeup person, but for somebody out there, that is liberating them and making them more free to live the life that they want to. So to cross-sector, the best example I have is a program I'm involved in called the APEX program. It's www.theapexprogram.com. It is a virtual training, certification, and placement program to launch blind people into careers in cybersecurity. That came out of a 2-year research cooperative agreement that I had at the American Foundation for the Blind with the Federal Ability One Commission to bring forward 3 new lines of business that could create career pathways into knowledge-based careers for people who are blind, and one was cybersecurity. And I've partnered with a privately held cybersecurity company called NovaCoast. They have a large consulting practice with global financials. They have a federal practice, a training business, a cybersecurity conference business, a placement business. And one of their founders has a blind child. And when I started talking to them about cybersecurity for blind people, they got very excited. So I think someone asked, how do you start inclusion? It's how does an oyster make a pearl? You start with a grain of sand, and often that grain of sand is a personal, impactful experience someone has with disability, whether it's a child or a sibling. Jonathan Lazar was talking about Senator Bob Casey. He was the successor to Tom Harkin, who was one of the driving forces behind the ADA, because Senator Harkin had a disabled brother, and that's what motivated him. And when he retired, his staff went to work for Senator Casey. So earlier I said cross-sector, you need government, corporate, nonprofit, and community in order to make anything really big happen, and the APEX program is designed that way. We have established relationships with vocational rehabilitation agencies in 24 states so far, which are funded by the Department of Education and their state agencies, so that's the government piece. We have identified 70 employers who are all having challenges finding enough qualified, certified cybersecurity people to hire, so we have the corporate piece. We've partnered with nonprofits around the country who have a mission to accelerate employment of people with disabilities in their particular communities and have philanthropic dollars to do that. And then we've engaged the consumer groups in all these states, namely the American Council of the Blind, National Federation of the Blind. So bringing all 4 of those sectors together is what makes it work. Yeah, I would just say anytime you're trying to take what you know to improve people's lives, you want to have built in your design, your outcomes measurements. Michelle just mentioned indicators. Some of this stuff is so long-term, it might not, well, getting the employment rate of people with disabilities equivalent with the general population probably won't happen in my lifetime, but I would like to see some indicators that we're making progress along the way. So whether it's indicators or outcomes or targets. I work with Seattle Theater Group here in Seattle. For those of you who live here, they run the Paramount and the Neptune and the Moore. Their executive director has 2 kids with disabilities. He wants his audience to reflect the community, which would mean about 15% of the audience and 15% of the employees should be people with disabilities. So we've established some targets and some timelines, and we're measuring the percentage of people employed by Seattle Theater Group who have a disclosed disability. So that's a very simple measurement. For the APEX program, we've built in quality of life. So we ask people to do a quality of life survey when they start it, when they finish it, when they get a job, and then we'll measure that longitudinally over time. Yeah, human rights. Thank you, Michelle. Perfect. I will put in a plug for the vocational rehabilitation system and the Rehabilitation Act, which is still the law. And if you are interested in employment of people with disabilities, it's the best resource we have. Their budget is $4 billion. Every state has at least one vocational rehabilitation agency. We have 2 in our state, Commission for the Blind and Department of Vocational Rehabilitation. And they can do a lot. You're entitled, person with disabilities entitled to start receiving services at age 14. You're entitled to individual plan for employment, which include them paying for your education through your PhD. They can provide equipment and training and workplace assessments, and for employers they can pay salaries during on-the-job training. They can do a lot. They often need to be coerced into doing what they're supposed to do, but my working proposition is if there's a person with a disability who wants to become employed in the United States, they should be getting every ounce of resource they're entitled to from the vocational rehabilitation system. Well, it's a process. And Bill, I think you and I were together at Boeing and Everett report out on a study that Boeing and Alaska Air and Teague did. It's a cultural transformation. It's creating that inclusive environment. It's working toward getting to that tipping point of a significant number of people with disabilities. And I recommend that organizations start through promoting self-disclosure and really leading with accommodations and talking about accommodations, because we know that companies, when they're asked to report, they say they have 1.5% to 4% of their employees have disabilities. And we know demographically they have 10 to 15% of their people have disabilities. 70% are non-apparent. So to start encouraging self-disclosure by showing the power of accommodations to the company and the employee, how an accommodation can help the person bring their whole self to work, can make them more efficient, more impactful, more healthier, more support their mental health by having what they need to do their work, and to start doing that by giving examples. Boeing's a big ship to turn, Bill. But at some companies I say, let's bake this into the annual performance review. Let's have the managers talk about accommodations to every employee that they do a review with and give some examples. Say, you know, some people have a bigger monitor, some people have a stand-up desk, some people need a flexible work schedule and they need 2 hours between their shifts, morning and afternoon. So many accommodations are simple, and the most common one is flexible work schedule. So again, I think starting to get people to talk about it, starting to get people within the organization who are there, who have disabilities, who haven't asked for the accommodations they're entitled to start talking about that, start using it, and just beginning to move things toward that more inclusive, more comfortable environment around disability and accommodation.